Peter Zacharia. I'm a ophthalmologist and glaucoma specialist in Worcester, Massachusetts. My practice is a glaucoma practice. We do very little general ophthalmology. In a given day, we might see, say 45 patients. Most of them have very advanced glaucoma, multiple medications, usually referred in by another ophthalmologist. We might have one or two patients coming in for a diabetic exam or referred in specifically just for cataract surgery. So the vast majority have glaucoma, are on many medications. There are many patients who ultimately require glaucoma surgery.
That's another drop. It's going to sting a little bit.
I don't see glaucoma as being very complicated. There's a fairly simple, I think, algorithm for how one would treat a glaucoma patient, but I think in residency they might look at it as pretty daunting, and they might shy away from the glaucoma field, even though glaucoma patients are really our bread and butter in ophthalmology. They represent a large percentage of our patients. Once some people might initiate medication or two, or perhaps do a laser trabeculoplasty, it might become a little more difficult to manage some of the patients who aren't controlled on these simpler regimens. I had a very highly myopic patient. I believe she was about a 12 diopter myope, and she needed glaucoma surgery. Her pressure was poorly controlled. I'd been following her for about 6 years, and I really wanted to see if we could avoid doing a trabeculectomy to her. She was a contact lens wearer. She was relatively young, in her mid-40s. So I called up Doug Ree because I think I heard he was doing this. So he ended up doing a trabectome on this patient. Shortly after, it piqued my interest, and I liked the concept, and I started doing it myself within a few months later. I liked the fact that I could do a procedure that wasn't as anatomically disruptive to the eye and would offer quicker rehabilitation period. This was interesting for me, and also the concept of removing the meshwork and the inner wall of Schlemm's made sense. So I wanted to do a procedure that wasn't as disruptive and offered a quicker rehabilitation time.